All attending caregivers need to be aware of the signs that are symptomatic that the end of life's journey may be near. Several changes occur both physically and mentally. The following explains those symptoms and suggests ways to comfort your loved one. 1. Cool skin. Their arms and legs may begin to feel cool to touch. You may also see visual changes to their skin. It will start to mottle and take on blue and purple hues. It may not be noticeable initially because it generally starts at the feet and works its way up. Eventually, it will become visible on their fingers, earlobes, and lips. You can make them more comfortable with warm blankets, but do not use electric blankets, as their skin is prone to burn. 2. High fever. Your loved one may or may not develop a fever. If they do, and as the end draws nearer, it can rise upwards of 104 degrees. To make them more comfortable, we suggest dressing them in lighter clothing and applying moist cloths to their forehead and the back of their neck. Tylenol may lower their temperature, but it often loses its effectiveness as the end of life draws near. 3. Sleepiness. You may find your loved one gradually begins to need more sleep, and at times they may be difficult to arouse. It's pretty common for a loved one to spend more time asleep than awake. When this happens, we suggest you pay attention to their sleep patterns and plan your time with them accordingly so that the time you spend with them is when they tend to be most alert. In addition, as they begin sleeping more, you or other family members should stay near to them so they can feel your presence. 4. Confusion. Your loved one may become increasingly confused about time and place and may have difficulty recognizing family members. Remind your loved one what day it is, what time it is, who is in the room, and who is talking to them. Then you can try to orient them to reality by using familiar objects and pictures of loved ones. Adversely, patients may experience a final rally in which they may seem better, more alert, happy, and at peace. However, this is often a sign that they are getting closer to the end of life's journey. 5. Hearing and vision. When your loved one's vision begins to fail, they may only be able to see what is near them. However, just because their eyesight is failing doesn't mean their hearing is also failing. So please don't mistakenly speak about your loved one like they cannot hear what you are saying. Instead, please take advantage of their ability to hear you and speak to them directly so they know that you are with them. Touch them, hold their hand, and let them know that you are by their side. 6. Decreased appetite and refusal of food and fluid. When life is reaching its end, the body begins to surrender to the inevitable, and the patient will start to reject sustenance. The desire for food and water will diminish, which is natural, and you should respect their wishes and not try and force on them something they do not want. However, you can still provide comfort by moistening their mouth with a moistened wipe or with ice chips. You may also apply lip balm to soothe dry lips. 7. Shortness of breath. As the end of life approaches, your loved one's breathing patterns will change, and there will be more extended periods between each breath that can last between 10 to 30 seconds. This pattern of breathing is called an apnea pattern. Your loved one may also have periods of rapid breathing, followed by periods of apnea. This is called Cheyne-Stokes respiration. Both are common conditions. Comfort may be provided by elevating your loved one's head, and morphine can help alleviate their shortness of breath. 8. Oral secretions. Oral secretions may begin to collect in the back of the throat because they can no longer swallow or cough effectively, which causes a rattling sound. This distinctive sound is the death rattle and is a normal part of the dying process. While a death rattle can be upsetting to hear, it usually causes no patient discomfort. However, a cool mist humidifier may help decrease the sound, and elevating their head with pillows should make breathing easier. Repositioning the patient may also help. Using drugs from your e-kit can help dry the secretions, minimizing the rattling sound. 9. Restlessness, anxiety, repetitive tasks. You may notice that your loved one becomes restless and may experience anxiety. You may also see your loved one pulling at the bed sheets, grabbing things in the air. It is not unusual for them to speak to family members that aren't in the room, and in some cases, to family members who have passed away. These are typical behaviors at the end of life. Just be with your loved one, speak calmly to them, and reassure them that it is all right to let go when they are ready. Valium or Ativan included in your e-kit can also be used for restlessness and anxiety and is included in your e-kit provided by hospice associates.